Fit for duty drug and alcohol policy. Fit for duty. Versys is committed to providing a safe work environment for its employees and subcontractors. To maintain a safe working environment, it is essential that employees and subcontractors are physically able to perform the duties associated with their assigned tasks. It is our duty to send each worker home to their families whole, healthy, and at the same time to ensure their job security. Worker responsibilities. Workers cannot enter the workplace while under the influence of drugs or alcohol. Workers must report all medications they are taking, including, but not limited to, over-the-counter medications for allergy or colds and flu. Workers must ensure that they are physically and mentally fit to perform their job functions safely. Workers must take responsibility for their own safety as well, not to report to work in a condition that may endanger the safety of their fellow workers. Workers unable to perform their duties due to personal health and/or personal issues must remove themselves from being available for work. Management responsibilities. Management must ensure all workers are trained to perform their work safely and informed of the fit for duty and drug and alcohol policies. Ensure supervisors are trained to assess worker behavior for signs of fatigue, impairment, and lack of physical or mental fitness. If a worker is deemed unfit for duty, management will provide reasonable assistance to the worker up to and including modified work, leave of absence, personal accommodations, and employee assistance programs. Each individual case will be investigated by management for a personalized solution. Alcohol and drug policy. Workplaces contain many hazards, and it is essential that all employees and subcontractors maintain the highest possible state of alertness. Versys promotes the safety and dignity of its employees, the welfare of its employees and their families, protection of the environment, and the best interests of the owner, the client, and the public. There is a zero tolerance policy towards the use of alcohol and drugs at Versys. The drug and alcohol policy requires ongoing commitment and attention from everyone at Versys. The following are strictly prohibited while at Versys or on any of our clients' work sites. Any use, possession, transportation, offering, or sale of illicit drugs, paraphernalia, or unprescribed drugs for which a prescription can be legally obtained and is required. Presence in the body of illicit drugs, unprescribed drugs for which a prescription is legally required, or metabolites. Use, possession, distribution, offering, or sale of alcohol beverages. Employees performing work are prohibited from consuming any alcoholic beverages during their working hours. Employees are required to limit their consumption of alcohol prior to working hours so that there is not alcohol in the body while at work. Intentional misuse of prescribed medications, over-the-counter medications, or other substances. Being unfit for work due to the use of after effects of alcohol, illicit drugs, unprescribed drugs for which prescription is required, or the intentional misuse of medications. Being unfit for work due to the effects of the legitimate use of prescription or over-the-counter medications. Management and supervisor responsibilities. Monitor worker performance and address situations where performance is consistently or sporadically fails below the expected level of performance. Monitor work performance and identify, documenting, and addressing performance problems in accordance with Versys existing discipline policy. Ensure the worksite is safe for all employees, subcontractors, and visitors. Worker responsibilities. Understand and comply. Understand and comply with the alcohol and drug policy. Workers must take responsibility to ensure their own safety and the safety of others. They must ensure they comply with the work standards as part of their obligations to perform work activities in a safe manner. They must comply with the policy and follow appropriate treatment if deemed necessary. They must use medications responsibly, be aware of potential side effects, and notify their supervisor of any potential unsafe side effects where applicable. They must encourage their peers or coworkers to seek help when there is a potential breach or breach of policy. They must ensure that all employees understand the existence and content of the Versys policy as part of the employee orientations. And they need to ensure alcohol and drug testing is performed according to the standards set out in the alcohol and drug policy model. Testing. Workers will be required to be alcohol and drug tested in the onboarding process prior to starting work on client sites. Workers may be required to have pre-access drug and alcohol screening prior to beginning work on any site as required by the client. Versys may perform random drug and alcohol testing of employees in safety-sensitive positions. Random testing is part of our contractual obligations with clients. Employees will not be giving advance notice of any random testing that will occur. If a work's ability appears to be adversely affected due to the likely use of drug and alcohol, Versys will send the worker for reasonable cause testing once the determination that reasonable cause exists. Workers are subjected to testing for alcohol and specified drugs after any significant incident has occurred. If a worker has not worked for Versys for over 30 days, the worker will be subjected to be retested for drugs and alcohol. Also, every 36 months of continuous employment, the worker will be subjected to be retested for drugs and alcohol. Any employee who has tested positive and is returning to work after an assessment must successfully pass a drug and alcohol test before returning to duty. A substance abuse expert may determine the need for frequency of follow-up testing. All test results are kept confidential and will not be disclosed to anyone other than a person who needs to know the test results to discharge an obligation under the alcohol and drug policy.